Welcome. In this video, we're diving deep into a specific type of cancer affecting the urinary system, transitional cell carcinoma of the ureter, also known as urothelial carcinoma. We'll explore its causes, how it develops, its symptoms, diagnosis, treatment options, and more. Join us as we unravel the complexities of this condition. So, what causes transitional cell carcinoma of the ureter? While the exact cause is often unknown, several risk factors have been identified. Smoking is a significant contributor, as the carcinogens in tobacco smoke are filtered by the kidneys and concentrated in the urine, exposing the urothelial cells to these harmful substances. Exposure to certain industrial chemicals, particularly aromatic amines used in the dye, rubber, textile, and paint industries, also increases the risk. Long-term use of certain medications, such as phenacetin containing analgesics, and chronic inflammation or infections of the urinary tract are other contributing factors. Genetic predispositions and family history may also play a role, albeit less commonly. It's important to note that having one or more risk factors does not guarantee that someone will develop the disease, but it does increase their likelihood. Let's delve into the pathophysiology, how this cancer actually develops. Transitional cell carcinoma, or urothelial carcinoma, arises from the urothelial cells that line the ureter, the tube that carries urine from the kidney to the bladder. Initially, these cells undergo genetic mutations, leading to uncontrolled cell growth and division. These abnormal cells can form a tumor within the ureter. Over time, this tumor can invade deeper into the ureter wall, potentially extending into surrounding tissues and organs. In some cases, cancer cells can break away from the primary tumor and travel through the lymphatic system or bloodstream, leading to the formation of secondary tumors or metastases in distant locations. The process is complex and influenced by a combination of genetic and environmental factors, leading to a disruption of normal cellular regulation and the development of cancer. Now, let's talk about epidemiology. How common is this cancer? Transitional cell carcinoma of the ureter is a relatively rare malignancy, accounting for only a small percentage of all urinary tract cancers. It is more prevalent in older adults, typically those over the age of 60, and is more commonly diagnosed in men and women. Geographic variations exist, with higher incidence rates observed in regions with greater exposure to industrial chemicals and higher rates of smoking. While the overall incidence is low, it's crucial to be aware of the risk factors and symptoms for early detection and treatment. What are the signs and symptoms of transitional cell carcinoma of the ureter? One of the most common presenting symptoms is hematuria, or blood in the urine. This can be microscopic, only detectable under a microscope, or macroscopic, visibly apparent in the urine. Flank pain, which is pain in the side or back, is another common symptom, often resulting from obstruction of the ureter by the tumor. Other less frequent symptoms include frequent urination, painful urination, and a persistent urge to urinate, even when the bladder is empty. In more advanced stages, weight loss, fatigue, and generalized weakness may occur. It's important to consult a healthcare professional if you experience any of these symptoms, especially hematuria, as early detection is key to successful treatment. How is transitional cell carcinoma of the ureter diagnosed? The diagnostic process typically begins with a thorough medical history and physical examination. Urinalysis is performed to detect blood or abnormal cells in the urine. Imaging studies, such as a CT urogram or intravenous pyelogram (IIVP), are crucial for visualizing the ureter and identifying any abnormalities. Ureteroscopy, a procedure involving the insertion of a thin, flexible tube with a camera into the ureter, allows direct visualization of the lining and the ability to take biopsies of suspicious areas. Biopsy samples are then examined under a microscope to confirm the presence of cancer cells and determine the grade and stage of the tumor. Cytology, the examination of urine samples for cancer cells, can also be helpful, especially in detecting high-grade tumors. While there aren't rigid classifications like some other cancers, urothelial carcinomas are often grouped based on their location and extent. We primarily focus on the staging, which indicates how far the cancer has spread. The TM staging system is commonly used, where T describes the size and extent of the primary tumor, EN indicates whether the cancer has spread to nearby lymph nodes, and EM indicates whether the cancer metastasized to distant sites. Tumors are also graded based on how abnormal the cancer cells look under a microscope. High-grade tumors are more aggressive and have a greater tendency to spread. What are the treatment options for transitional cell carcinoma of the ureter? Treatment strategies depend on the stage, grade, and location of the tumor, as well as the patient's overall health. Surgery is often the primary treatment for localized tumors. This may involve a partial or complete nephrouterectomy, which is the removal of the kidney and ureter. In some cases, a segmental resection, the removal of only the affected portion of the ureter, may be possible. Chemotherapy, using drugs to kill cancer cells, may be used before surgery to shrink the tumor or after surgery to eliminate any remaining cancer cells. Radiation therapy, using high-energy beams to kill cancer cells, may be used in certain situations, such as when surgery is not feasible. In some instances, intravesical therapy, where chemotherapy drugs are instilled directly into the bladder, may be used to prevent recurrence in the bladder after ureter surgery. Immunotherapy is a newer treatment option that uses the body's immune system to fight cancer. Can we prevent transitional cell carcinoma of the ureter? While there's no guaranteed way to prevent it, several measures can significantly reduce the risk. The most important step is to quit smoking and avoid exposure to secondhand smoke. Minimizing exposure to industrial chemicals, particularly aromatic amines, is also crucial. Staying hydrated and maintaining a healthy diet may also play a role in reducing the risk. Regular check-ups and screenings, especially for individuals with risk factors, can help detect the disease early when it is most treatable. What is the prognosis for transitional cell carcinoma of the ureter? The prognosis varies greatly depending on the stage and grade of the tumor, as well as the patient's overall health and response to treatment. Early-stage tumors that are confined to the ureter have a better prognosis than more advanced tumors that have spread to lymph nodes or distant sites. Advances in treatment, including new surgical techniques, chemotherapy regimens, and immunotherapies, have improved outcomes for many patients. Research is ongoing to develop more effective therapies and improve our understanding of the disease. Recent studies are exploring the role of targeted therapies, which target specific molecules involved in cancer cell growth and survival. These therapies offer the potential for more personalized and effective treatment options in the future.